Welcome back in another award-winning segment. Keep it local, Columbia County. Christine Dahlgren, Marty Rowe around the table with Dr. Joe Skariah from OHSU Family Medicine in Scappoose. I have to be careful, my doctor's there too. And Julie Thompson is here from the county PR department.
Yes, sir.
Yes, she's wearing the megaphone today, but Dr. Joe was good enough to come on and do some ads about getting the vaccine. So let's start with you, Doctor. This is kind of a critical time for us to let people know that we have vaccine and it's time to get your shots.
That's right. I'd say over the last 4 to 5 months, we've really been trying to build up the capacity here in the county. Mm-hmm. We're a county that doesn't have a hospital. I know you all know that. And so we have really had to build the groundwork from the ground up. And it's been a great effort from local healthcare providers. And we have now capacity in the county. Well, we need our arms.
Let's do it.
Yeah. We have, in case people don't know, all of our local pharmacies do have the ability to give vaccines, so that's a great option. Mm-hmm. Also, within the health systems, there are people giving vaccines to their own patients. Mm-hmm. And then with the county, we've worked with OHSU to put up essentially mini mass vaccination sites in the county. So we right now have vaccines available Wednesdays, Fridays, Saturdays, Sundays. So a lot of options for people to sign up and get their vaccine.
That's wonderful news. And of course, I think the big question is, do we need to call somebody? Can we just walk in? Maybe talk to that for a second. How's that work?
Correct. We're actually trying to take whatever way we can. We're trying a bunch of different methods to try to get people the shot. The easiest way is if you were to go to the county website, so www.columbiacounty.or.gov/vaccine. If you go to that site, you can see the different places where the vaccine is offered, and you can click and schedule appointments for yourself. So it's as easy as that. All you have to do is get online and do that. Otherwise, you can call the pharmacies or call specific sites, and they will direct you toward walk-in appointments that are available. We are currently at our mass vaccination sites. We're taking walk-ins on Wednesdays in the evening, Fridays in the evening, and Saturdays during the day. On Wednesdays in the evenings, we are asking for people to come around 6 p.m. That's about where the initial rush of patients who have signed up will have kind of gotten through the registration, and then they can put themselves on a list to walk in. The same thing can happen on Fridays as well.
I know, talking with Mike Paul, he's told me that there's some frustration because, like the FEMA trailer, I think went up to Clatskanie, and they didn't have anybody showing up. For so long we've been trying to build up the capacity, but now that we have the capacity, it is really getting to the people about why they should be getting these shots. And so that is on us. We've taken it on us to try to do that. It's part of me coming here and talking to you today, because I think there are good questions that people have in their minds, and reasons that they're unsure about getting the vaccine. And what we want to do is let people know it's safe, it's effective, and with the recent kind of governor's orders or thoughts around reopening, really imperative to kind of bring our county back and get us back to what we think of as normal life. What did she announce just Tuesday? 70%, and the state is open.
Yep, and the state is open. And that means, we're a county that's really been struck pretty hard by the shutdown. It's been needed. It's the only way we've been able to really kind of keep our population as safe as it has been. When you look at Oregon compared to other states, we've actually done a lot better. I know that when I see that when I work in the hospital, it is hard to see that people have been sick by COVID. When I talk to my colleagues across the country, we have been better off. We know that. But now it's time to look to reopening. We have the opportunity to reopen. We can do it safely. And I think that what we need to do is get to the folks who are thinking about the vaccine and have good questions about it. And what we need them to understand is it's safe. It's effective. This is a way that they can protect themselves, they can protect their family, and the way that they can really show that they care about this community.
So a question, we have both had our shots, both
Chris
Marty
had
and
the
I.
Pfizer, I had the Moderna.
Right, and up until the time when I was able to schedule my husband and I, wherever we were, we got whatever was available at that site. But I think now you have choices when you go into some of these pharmacies or even to the clinic here in Scappoose. You can choose whether you want this one or that one. Speak to that a little bit.
Yeah, definitely the pharmacies. The allotment comes from a different place, and so they've got definitely more options. I think all three options are open in our pharmacies. In Scappoose coming, we're trying to secure the Pfizer vaccine.
Sure.
We have the Moderna. We've had the J&J. Some of this is at the state level. When the states get the allocation, they then distribute across the state. And we've been open about we will take whatever vaccine we get because we want to get vaccines out. So we have not been picky about what we get or what we don't get. But we are looking to, especially like with next week with the thought of 12 and up being eligible, really making sure we have enough of that Pfizer allocation because that's what's approved, what we think will be approved for the 12 and up. But yes, that is the question to ask when you're calling to schedule your appointment is, which vaccine's available, which one would you like? Yeah. There are some that we're going to be careful about, like with the J&J, we are careful with the population that we think that leads to some of the clotting disorders that we saw. And then there's age limitations for some folks, but we really want people to know that there are options out there now. It's not like in the beginning where there was only one. You got what you got in the county.
One and that was it.
There are options, and the pharmacies have really been able to open that up for us.
Well, and with the kids coming in now, 12 and up are now approved, but just for Pfizer.
Correct.
So we need to make sure that if you're scheduling your child to come in, which is a really smart idea to do it now instead of waiting till August.
That's right.
Because the kids are going to need it when they go back to school, and it's going to be swamped again.
Yep.
Make sure you let these people know that I have a 13-year-old. Exactly. It's got to be Pfizer.
Exactly.
I want to challenge Julie a second because she's had a real PR challenge, public relations. We listen to the commissioners every week, and I know Henry has kind of put Michael Paul on the spot a couple of times. Michael's done a great job in answering the questions, but getting the word out. It's been a real challenge for the county, right?
It has been a challenge. Columbia County is very rural, and we've got a lot of rural residents that don't have access to internet sometimes. So it's been a lot of strategizing, figuring out how do we reach everybody, how do we get the message where it needs to go.
I was going to ask Dr. Joe, too, if I'm living in Mist and I don't have internet, the best source is my phone, right? My telephone.
Right.
So...
Well, and I found when we finally got ours, because my husband and I are both over 65, so we were in that bubble of nobody can get through on a phone line or on the internet. So I finally called, and I found that was easier because I couldn't get anything on the internet. It was so jammed at that point.
Yeah, and let's share that number again, just in case, especially if you're tech savvy or you have a hard time getting through the computer. It's kind of a long process sometimes. You can call Columbia County Public Health, and their number is 503-397-7247.
Fantastic.
And they will help you through the process.
Well, and they have like a newsletter or something. If you sign up for on their site, they actually send you updates all the time.
Absolutely.
I finally got to the point where I discontinued that because we already have our shot. But those were really, really helpful.
Yeah.
And I understand that the pharmacies now, you can call the pharmacies directly and see if they have what you want. And that's another way of kind of maybe bypassing if you're getting a little bit confused about how to use the internet or whatever.
Yeah.
Well, shoot, we were in Walmart the other day and we heard overhead, come and get your vaccine. Vaccine's available.
Perfect.
So,
I love that.
It is, we are trying to make this as easy as we can. And Julie's right. There are different strategies for different parts of our county.
Right.
But the thing to think about is that our county falls in line with a lot of the other rural counties in the state. Even though we're only 30 minutes away from Portland, we have really been trying to think about how do we get the word out. And so phone, internet, walk-in, whatever it takes really is what we want.
Well, just about out of time, so I do want to ask you, where do we stand in the count, the vaccination count, and how does that compare with the other 35 counties? So we are behind what we think of as the metro area. We are significantly behind. And when we look to our west in Tillamook and Clatsop, we're also behind. And so, we're in that low 30% of where we are in vaccinations.
I just kind of want to gauge that because we got to get to 65% before the fair.
That's right. That's what I'm thinking. That's it. Yes.
Let's go.
Exactly.
And really, there is room for these mass sites to succeed. So but we can't keep them open if they're not filling.
Right.
And that's the other piece here is they will, what we're seeing in the metro areas, that they are disappearing, right?
Yeah,
there is an end date to PDX Airport, Hillsborough Stadium, and that's
the
convention center. Right. As all this, and I don't think we've hit that number yet in our county.
Okay.
I feel like there are plenty of people who are kind of on that fence thinking about it, and what we need them to do is to reach out to friends who have gotten it, find out really what the experience was like.
Sure.
Reach out to their doctor.
Exactly.
Find out, ask your doctor, what do they think? What have they seen? What has happened in their county? I will tell you, we have given over 15,000 shots in this county. I've been at many of those events. The biggest medicine I have to give people after a shot is juice, believe it or not, because people come in, they don't eat, they get the shot, they're just dehydrated. Yeah. And that is the biggest medicine I've had to give is 3 or 4 juices, and people are just fine. So it is totally safe. It is totally effective. But reach out to the people you trust about healthcare.
Sure.
Find out, because I think that we can vaccinate more people in a large bolus, and then pare it down. I in my heart believe we still have room to go on this, and we have a big push to make.
Let's push hard.
Yeah, I think there are people that are still leery about getting it because they've heard their side effects. My big thing that I've been trying to tell people is if you've got side effects, that means it's working.
That's it.
That's what you want.
That is exactly what I tell people.
That means that it's all good. Your system's working the way it's supposed to be working.
Correct. This is a dead vaccine, meaning when you get the vaccine, you're not getting coronavirus.
Right. No.
Right? It is a dead vaccine. So you can't get coronavirus from it. No. But you will get is a sore arm, and then the second shot, you're going to feel under the weather, and that's just your immune system working. You want to, the sicker you feel, actually, the better your immune system is working, so that when you are exposed to COVID, you do have a way to fight it. So that's what we want people to know. You should expect this, and then about 3 days later, you're going to feel just fine.
Sounds good to me, Dr. Joe Skariah and Julie Thompson. Thanks for coming in, guys.
Thanks for
Good
having
job.
us.
Good show.
Thank you so much.
An award-winning segment.